So welcome to Unit 3. In Unit 3, we are going to discuss the nurse aide's role in assisting with hygiene and oral hygiene, and bathing and grooming and elimination needs. Unit 3 will comprise of chapters 13, 16, and 17 in your textbook. For the skills, this will cover skills number 11, 12, 13, and 15. And we may also include chapter 15 in this recording so that you can discuss nutritional needs, meal assistance, and special diets. If it's not covered in this unit, then I will record chapter 15 as an additional to Unit 3. Okay, so let's get started. So like I introduced the unit earlier, personal care of the residents that you'll be taking care of. As we have discussed from before, remember a nursing home or a long-term care facility, or even in just other services, the centered person is your resident. So you are going to have a personalized centered care, even with hygiene. So their daily hygiene needs, their oral hygiene, bathing and skin care, nail care, dressing and grooming. So each resident has a personalized care because not every resident will have the same routine like the other resident. So before we get into the details of our personal hygiene, let's look at what affects personal hygiene practices. Some factors here listed are family, their culture, learned behaviors, disability, and age. And then individual needs. Some residents may be ill. It could be an acute or chronic. They could have a cognitive impairment. Individual preferences as to when they would like their hygiene to be completed, like what time would they prefer their shower or a bath. Some others include economics, maybe they are not able to afford, and then the environment. But as we know, when they are in a nursing home, economics really does not play a role here because everything is provided for them. And they also have an environment in which they are able to have their personal hygiene completed. Oral hygiene. Oral hygiene includes the mouth, teeth, gums, tongue, and dentures. So when you are performing oral hygiene, you know you are going to perform hygiene for the mouth, their teeth if they have natural teeth, their gums, the tongue, and if they wear dentures, you're going to clean their dentures. The benefits of oral hygiene, it prevents infections, disease, and pain. There has been studies that have shown that without oral hygiene, some of the infections can even lead to cardiac problems. you can have a heart attack because of the infections, and this may result into having a cardiac problem. Pain, the more oral hygiene is not performed, you can develop pain because of the infections in the mouth. You benefit by just having good oral health. It promotes self-esteem. You can imagine if you have no oral hygiene, sometimes residents that have not been able to have their oral care performed, they kind of feel shy to talk because maybe they might have an odor from the mouth. So, and they are just shy. So it benefits them when you perform oral hygiene. It promotes their self-esteem. Food will taste better. Social interactions kind of goes along with the self-esteem. It prevents odor, like I talked earlier. Normal function of the mouth is better because you have no infection. There's no gum disease or any other diseases of the oral cavity. And it also, without infections, you do not have pain. So your mouth will function normally. And it also prevents aspiration, because if you are not performing oral care, especially for a person who's unconscious, the saliva in the mouth can accumulate, and as a result can trickle down and cause aspiration. When to give oral care? Just like you and I would like to have our oral care done before breakfast, like first thing in the morning, after meals, at bedtime, and be sure to check their care plan. So before breakfast, when they wake up in the morning, before you take them to breakfast, you ensure that you have performed oral care. After meals is also very important, because some residents may pocket food in their mouth, and if that food stays in the mouth for a long period of time, you can imagine the bacteria will start building up. And this is the same with bedtime. They pocket food, they go to bed without oral care, that food will stay in the mouth until the next day. You are creating a reservoir for infection. Be sure to check their care plan so that you know for sure what type of oral care they need. Do they have dentures? Do they have natural teeth? Or do they have no teeth at all, and you are to perform oral care just on their gums and tongue? Perform oral care frequently on an unconscious person. A person who is having nausea and vomiting, you know they are not well, and they get sick to their stomach, they throw up. Ensure that immediately after you are doing oral care. If they have an elevated temperature, ensure we are doing oral care, because they might be having an infection in the mouth, and that's why they are having an elevated temperature. Certain medications may require oral care. So like I said, check the care plan. It could be in their care plan that after they take a certain medication, you probably have the nurse, or the nurse might give you instructions to perform oral care just because of the medication that they have taken. People who are mouth breathers usually have a dry mouth, so you would want to perform oral care so that their mouth remains moist. Persons who are on oxygen also tend to have a dry mouth, so ensure you are doing oral care. If they have a history of mouth or gum problems, these are people that you will want to do oral care for the most part. And then persons who are at the end of their life because they are unconscious, they are not able to do anything for themselves, or they have a condition that they are just so weak that they cannot perform their own oral care. So you are there to assist them. Follow standard precautions when doing oral care, and standard precautions here will ensure that you have your gloves on. Remember, anything that has to do with body fluids, that includes saliva, mucous membranes, you would want to wear gloves when performing oral care. When performing oral care, be observant. Observe and report if your resident complains of any mouth pain. If you notice that their teeth are loose, or if they've got a chipped or broken tooth, or even the dentures, like we note when cleaning the dentures, inspect them to see if they've got any problems. If they have any chipped teeth, you will want to report that. A foul mouth odor, which you may notice, maybe they've not had that foul odor before, and all of a sudden there's this odor from the mouth, you want to be reporting that. Dry, cracked, or bleeding lips, bleeding gums, sores around the mouth or in the mouth, and a coated or swollen tongue. So like you can see from these images here, sometimes you can see residents developing these problems. So you would want to be reporting that immediately. Types of oral hygiene. There are those that you can assist because they are able to do part of it themselves. So you would want the resident seated in a chair, or maybe sitting in a chair and maybe in front of their little bathroom sink, or if in bed, then ensure that they are sitting in a Fowler's position. That is way up 90 degrees. For denture care, avoid cracking or chipping off denture. So when you are cleaning their dentures, just ensure you're handling them properly so that you do not end up chipping anything from those dentures. And like I indicated earlier in class, dentures are very expensive. Once you clean the dentures, ensure that you store them in cool water, or otherwise give them to the residents so that they can put them in their mouth, especially if it's in the morning. At bedtime, you will want to clean the dentures and put them in the little denture cup and keep them by the bedside or in their bathroom. Edentulous care, this would be residents who have got no teeth or they are toothless. So you want to use the swabs to clean their gums instead of a regular toothbrush. You also clean the mouth, tongue, and gums with mouthwash and water solution. You are not going to be using toothpaste on a person that has got no teeth. For an unconscious person, ensure you sideline them or turn the head to the side. Use swabs or the toothaches to clean teeth, mouth, and gums and their tongue. And you are not to pour liquid into a mouth of an unconscious person because they can easily aspirate. Bathing. So the benefits of bathing: it promotes good health, makes them feel clean. You are clean after you bathe. It prevents skin breakdown, because if you are not bathing, the skin will dry and very soon it will start cracking and you have a skin breakdown. Bathing also promotes circulation. You can imagine, just even when you are having a shower, how well you feel when you take a bath or take a shower, and that massaging while showering or bathing creates good circulation. It relaxes you, and of course then you will not have any body odor. So when bathing a resident, regardless of whether you're bathing them in bed, if they're bed bound, or if you're going to take them to a bathroom or a shower room, you are to provide privacy, standard precautions. You wear gloves, and especially if you're going to do pericare. Give choices as to what they would like. If they would like a shower or if they would like a bath in a bathtub, ensure you're giving them those choices. Or if they would like a whirlpool, if the facility has a whirlpool, some facilities have whirlpools, so you give them the choice. And also give them the choice as to when they can take a shower. I know in most facilities there is a schedule for residents as to when they can take a shower, but sometimes they would not want to take a shower in the morning, even though their shower is scheduled for the morning. You can then offer them to say, if you do not want to take a shower this morning, can we take a shower in the afternoon? Offer toileting before you take them to, before you bathe them. Sometimes they would want to use the toilet before they get into the bathtub or before showering. Avoid chilling, keep them warm. Ensure that your shower room or your bathroom is nice and warm. There are provisions in a lot of facilities to warm the room before you give them a shower or a bath. As you can imagine, with elderly people, their skin is so frail and they do not have that much of a fat to keep them warm. So you do not want to expose them to cold. And keep them safe. Safety is a big deal with showers or bathing. Make sure that the floor in the shower room is dry. And then just ensure you're maintaining that safety to prevent falls. Keep the water warm and clean. Your water temperature, the standard is 105 to 110. Pat dry their skin. Do not rub the towel on their skin, because sometimes the towels are kind of rough. So make sure you're pat drying instead of rubbing down. Pay special attention under the breasts and the skin folds, especially for residents who are kind of heavy set. Make sure if they have any skin fold or under the breasts that you're getting under there and pat drying. Then for yourself as a caregiver, ensure you're using good body mechanics so that you do not hurt yourself. Infection control during bathing. You are going to wash the face first, then work from far to near side. Bathe clean to dirty areas or change water. This will be demonstrated, if not already demonstrated in lab. Glove when you are near any body fluids. So just have gloves on when you are doing, when you are cleaning, when you are giving a bath or a shower, because you never know when you're going to get into contact with body fluids. So to be on the safe side and to take those precautions, just have gloves on. And know when to take your gloves off. When you have completed pericare, and then you still continue giving the bath or continue to complete the bath, just make sure you change gloves. Make sure you clean and disinfect the bathtub or the shower room. Most facilities have cleaning material for you to use after you use the shower room or the bathtub. There are several bathing methods. A bed bath. This is for a bed bath is for a person who is not well or is bedbound, and for the most part, this is probably a person who has got maybe a general weakness. They are paralyzed, they are unconscious, or they have a cast or traction, and they are not able to get up and get into the shower room or the bathroom or the bathtub. You are going to give them a bed bath. A bed bath is washing the entire body in bed. A partial bath can be self or assisted. With a partial bath, you are going to wash the face, the eyes, hands, under the arms, the back, the peri area, and the buttocks. So for the most part, you're not washing the legs and the feet or the chest or the stomach area. You're just going to wash the face, hands, under the arms, the back, and the peri area. A whirlpool, which is a more relaxing kind of bathing. So I'm sure you have seen a whirlpool tub before. So it's more of a relaxing kind of bathing. A shower can be self or assisted. You get into the shower and you shower the whole body. A thermal bag bath. This is not commonly seen anymore, but if you were to do a thermal bag bath, you will pre-moisten washcloth. There's no rinsing necessary, and you just cover them up with warm washcloth. You can warm your washcloth in the microwave, and then you will use a new cloth for each part of the body, and then air dry the skin. It's not common now to see thermal bag baths. Safety with bathing: ensure you are preventing falls, because the risk of falling in a shower room is quite high. So just ensure you've taken all the precautions, and your floor is dry. Use safety devices as needed, like a shower chair, a gate belt or transfer belt, a tab chair, mechanical lifts, and the grab bars. So ensure that these interventions are in place before you head out to give a bath in the bathroom or the shower room. For residents who are weak or unsteady, ensure that you are close by and holding on to them so that they do not fall. And then when bathing them, before you even start bathing them, ensure that when you turn the water on, you are not turning the water on directly onto your resident. Turn the water away from them until it has come to a good temperature before you start splashing them with the water. Bathing a resident who has a cognitive impairment, taking them to bathe can be a frightening experience. So be aware of your residents who have got, maybe they have dementia, and just taking them to the tub room or to the shower room can be very frightening. It can also be very confusing. Imagine they're already confused themselves, and then you're dragging them into the shower room or to the tub room. It will just increase their confusion. And they can resist going to the shower or to the bathroom. So you have to take care of all these feelings and actions before you take them to the bathroom or to the tub room or to the shower room. Ensure they are in a good mood. Talk to them and assure them that it's going to be okay, and then you can proceed with the shower or the bath. Choose the best times. These are some of the techniques that you can use. Choose the best time, especially when they're in a good mood. Then that's probably the best time for you to take them for a bath or a shower. Have soft music. Do not rush them, and then give step-by-step directions throughout. Allow the individual to do what they can for themselves, like you'd with a washcloth and tell them, hey, Mrs. Smith, would you like to wash your face, while you are kind of gesturing what washing the face is. Use a calm voice and be gentle. With a confused resident or a resident with a cognitive impairment, approach them from the front, because approaching them from the back will only frighten them. They'll get confused, and most likely they will refuse to take the bath or the shower. Have your supplies ready before you head out to the shower room or to the bathroom. Because if you are going to take Mrs. Smith or Mr. Smith into the bathroom or the shower room, and you know that they can easily get frightened or confused about the whole thing, make sure your supplies are already ready to go before you even talk about the shower or the bath. This is a link to a video that you can watch. I believe this is how you can handle a confused person and how you can go about giving them a bath or a shower. Pericare or incontinence care. Perineal care is when you gently cleanse the peri area and the anal areas. Incontinence simply means the inability to control bowel and bladder. So you're going to use standard precautions, glove changes as needed. So you know you are going to be handling body fluids, so ensure that you change gloves even in between. For peri area or pericare and incontinent care, always clean from front to back. That is simply avoiding contamination. Clean area. Use a clean area of cloth for each stroke. This will be demonstrated in class if not demonstrated already. Areas to clean are the genitals, the anus, ABD, that is the abdomen, thighs, and buttocks. So this is when you do incontinent care. This skill will be demonstrated in class. Back rubs and massages. This is the physical and emotional health, especially when you have A resident that is agitated, you can do a back rub just to calm them down. Back rubs and massages also promotes blood circulation. They will relax a resident. And you can do a back rub or massage after a bath, especially in the evening, and you'll sleep better. And when you are doing your back rub or massage, ensure you're observing the skin condition just to make sure that there are no lesions or sores on the skin. Back rubs and massages helps calm agitated residents. So when you are doing a back rub or a massage, just ensure that your fingernails are short and use good body mechanics. You're not going to be bending over, so ensure that you raise the bed to a good working height. You can use warm lotion, and warming the lotion, you can just rub the lotion in the palm of your hands. It warms up, and then you can give long strokes up and down the back. And the long strokes and circular strokes to stimulate and relax your resident. Back rubs will be demonstrated, the skill will be demonstrated in class. Hair care affects how we look and feel, promotes independence, the choice if they want to have long hair, short hair, or how they like their hair to be combed. Brushing so that you can stimulate the scalp and good circulation, and comb the hair one section at a time and be gentle, because sometimes you have hair that is tangled, so you'd want to be gentle. Then after you've done your brushing and combing, just ensure that you clean the brush or the comb after use, and do not share the brush or the comb with another resident. So each resident will have their personal comb and personal brush. If they do not have a brush or a comb in their room, I'm sure the facility has a storage area where all these personal supplies are kept, and you can just go grab a brand new brush and a brand new comb for your resident. When performing hair care, report if there are any sores on the scalp, if there's too much flaking, or if the resident complains of itching, very dry or oily hair, of course the presence of nits and lice, or patches of hair loss, so that an intervention can be done. Flaking, usually there is, some residents have a special shampoo that is used. It's very common to see residents with special shampoos for their hair. So just make sure you're reporting if there are any of these listed here, if you see any of those. Shampoo, how often? Elderlies, usually in nursing homes especially, have a shower or a bath twice a week. So you can shampoo their hair then. Or otherwise, they have a beauty shop. They can go and have their hair done in the beauty shop. You can also use the shampoo-free caps. Some facilities have those. It's just a shower cap. You throw it into the microwave. It warms up. Rub it. You put it on their head and kind of massage it through. And otherwise, if you are going to shampoo their hair like in a shower, make sure you rinse off all the shampoo, because shampoo remaining in your hair can cause other problems. Refer to the care plan for those that have a condition that shampooing their hair can be an issue. Refer to the care plan. Like I talked about, they may have a special shampoo, and if they do have a prescription shampoo, for if anything, it will be in the care plan. Support the head when you shampoo their hair. The water is at least 105 degrees. Keep the soap out of the eyes, keep shampoo out of the eyes, because I know from experience that shampoo really stings when it goes into your eyes. Wear gloves if scalp has got sores, but if anything, just wear gloves. When in doubt, just wear gloves. Shaving, depending on what the need is. For the men, some of them will shave their face daily, so just ensure that you shave them. They may have an electric razor or a safety razor. The safety razor is referred here is like the manual razor that you just use and throw away. Make sure you soften the skin before you shave. You can use a pre-shave. When shaving a resident, especially men, when shaving, you're going to hold the skin taut, like stroking down, so that the skin is kind of tight before you shave. Circular motion with hair growth. So shave circular motions with hair growth. Legs straight up against hair growth. Use care not to cut, nick, or irritate skin. And then you rinse the body part and apply lotion or aftershave. This is a skill that we do not, we can discuss it in class, but for the most part, you will have an experience of shaving a resident when we go to clinical. Clean razor between use. So if it's an electric razor, just clean it after you've used it. For the manual ones, the ones that are referred to as the safe razors, you can rinse it out between uses, but after you are done with that, you just dispose of the razor into the sharp container. You are not to share razors. Then while shaving a resident, if at all you happen to cut or nick their skin, please report that immediately to your nurse supervisor. Residents who have dementia, it is not recommended to use the safe razors. You only use the electric razor, because with the safety razors, they can all of a sudden burst out or get up to leave while you're in the process of shaving them, and you can easily cut or nick their skin. So if dementia, use electric razors only. And for the most part, family members provide these electric razors. Nail care, it is the responsibility of an NA to make sure that the residents' nails are clean, but it is not an NA's responsibility to trim or cut nails. So you are only to clean and file, no trimming. The trimming will be done by either the nurse or the podiatrist. Toenail care can be done by the nurse or the podiatrist. Otherwise, especially for persons who have got diabetes or have got vascular problems or poor circulation, please do not attempt to trim or cut nails. Do not even try to trim or cut very thick nails, the ingrown nails, and if a resident is on blood thinners. So that is why you are not to trim or cut nails as an NA. Your responsibilities will ensure that you check between the toes, and then you report if you see any redness, cracked skin, irritated areas, breakdown on the skin. If the corns and the calluses are getting bigger or thicker, make sure you alert the nurse that, there is a concern. Nails that are very thick, any loose nails or discolored toes or nail beds, ensure you report that. Dressing promotes independence, and you are to assist the resident as needed. When you are dressing the resident, just like when you are bathing them or grooming, you are going to provide privacy. If their clothes are wet or soiled, you are going to assist them with changing that. And then for dressing, especially the outfits, maybe they're gonna go out or getting them dressed for the day, you're going to offer them choices. You're just not gonna go to the closet and pick out an outfit. You can pick out 2 outfits and then just kind of have them make a choice. Adaptive aids, you are going to use those or encourage the resident to use those if they have them, especially adaptive aids for putting socks on or for buttoning the shirts. There are always all these little adaptive aids that are available. Just encourage your residents to use them. When you are dressing a person or a resident that has got a weak side, you are going to dress the weak side first, because they can use the stronger side to assist themselves. So you're going to dress the weak side first, and then when undressing, you're going to undress the weak side last, because they can be able to use the stronger side to undress the weak side. So just bear that in mind when you're dealing with a resident that has got a weak side. Dress weak side first, undress the weak side last. These are some of the adaptive devices that are out there for you to encourage your residents to use. There's the sock aid, the dressing stick, the richer, a long-handled shoe horn, a button hook, and elastic laces or Velcro for their shoes. For the most part, elderly people will not be able, maybe they've lost the ability to tie their shoes. So for the most part, they'll have the elastic laces, or otherwise they'll just have shoes with Velcro on, a Velcro. Elimination needs, the use of a urinal, bedpan, and commode. So you are with if you give them to use a urinal or a bedpan, or even a commode, the commode is a portable toilet. You can bring it to the room and take it out. So just ensure that once they've used the urinal, the bedpan, or the commode, you observe. For urine, you're going to observe the color, odor, if there's any sediment in the urine, the amount, the frequency, and if they are complaining of any pain, or if they feel that the bladder is still feeling full even after they've used the urinal, you're going to report that. If they had a bowel movement, you're going to observe the consistency. Was it liquidy, or was it formed or hard? The amount, frequency, and if they had any problems. We are going to end this lecture here, and the next time we meet for Unit 3, Part 2, we'll discuss pressure sores and ulcers. Okay, thank you.